Good afternoon, everybody. I'm like the last batsman where nobody cares whether he bats or not, but I'll try my best to probably give you a quick update on post-procedure modalities. Okay, moving on to the presentation. Okay, this is a poem I kind of wrote last night. This is according to the lecture. And this is what most of our patients, the cosmetic patients, come to us and have cribs about. This says, I once went to a dermatologist who gave me pain. I vowed never to return cause he seemed so vain. He bruised me black and blue right when my anniversary was due. He did not tell me what to expect, babbled in some medical dialect. I wish doctors think of what happens next and do something about this post-procedure mess. So this is basically post-procedure modalities, and this is what I face day in and day out. A lot of times I end up bruising the patient, and I don't get those congratulatory WhatsApp that Anuj was showing. I get lots of abuses, choices of abuses at times. So these are the procedures I'll be covering: lasers, injectables, chemical peels, and cutaneous surgeries. In lasers, hair removal, fractional resurfacing lasers. So starting with laser hair removal, what is important post-procedure? Sunscreens we all know, don't need to emphasize. We need to avoid steam and sauna for at least 24 to 48 hours. Obviously the skin has been heated up, we don't want to heat it up further. Ice packs post-laser is getting important because of the paradoxical stimulation of hair growth. In fact, ice pack post-treatment in the clinic, around the treatment area, at home is the mantra now. So this is very important. Post-care calming creams are becoming quite common, and most of these major chains have their own range of post-care calming creams. A lot of people are using aloe vera gels to cool down the skin. We need to cool down the skin, especially after laser hair removal. Antibiotic creams are advised at times in case of blisters. Even vitamin E topical has been found to be useful in case of blisters post-laser. You have to avoid makeup for 24 hours at least, because you have an irritated skin, so you don't want to irritate it further by the use of chemical makeup. If at all makeup is to be used, it has to be a mineral-based makeup. These are some of the creams which are available, post-laser creams, and the ones that we have in India is Exomega. You can also use the other creams like Sika Bio by Bioderma, or you can have Epithelial AH by, again, Abbott. So moving on to fractional resurfacing lasers and devices, you have to wash the treated area gently with lukewarm water and avoid hot water in these areas. This is something interesting that I've discovered, that if you use a 4.4 gauze soaked with cool or tepid water diluted with a little bit of white vinegar, 1 teaspoon per cup, and this, if you gently go over the resurface area, would cut down the bruising, would cut down the issues of exfoliation, and the patient gets back so that the temperature is maintained and there's better collagen remodeling. Moisturizers and antibiotics are a key, especially post-fractional lasers. We have to also realize that PRP, as Dr. Joshi mentioned, is an adjuvant. PRP post-CO2 laser is a wonderful way to treat your patient. It helps to regenerate the skin's connective tissue, results in accelerated healing post-laser and post-chemical peeling. And there are a lot of papers on this. This is a photograph wherein a patient has done fractional laser, followed it up with PRP. So as early as 2 days, she's getting down to normal. Otherwise, it takes normally around 7 odd days for the patient to get back to normal. So this is a paper in JAMA wherein they have talked about PRP being an efficacious adjunctive treatment to carbon dioxide laser resurfacing and can aid patients in hastening the return to the normal routine. Another paper by Lee et al. Wherein they found that treatment with PRP after CO2 enhances the recovery of the laser damaged skin and synergistically improves the clinical appearance of acne scarring. So it helps both ways. It is cutting down the patient's morbidity, plus it is improving the results. Moving on to pigment lasers, ice packs here are important as there may be mild swelling. You avoid picking or scratching the treated skin. We are talking about pigmented area that we are treating. So if you pick or scratch that area, you'll cause more issues of post-inflammatory hyperpigmentation. And if there's any crusting antibiotic cream, it is recommended to use new makeup. Now this is something again that is important. Most of our patients have these makeups which have been lying on the shelf, the dressing tables for the last 3-4 months. A good idea to do any fractional laser, any sort of pigment laser, you ask a patient to open a fresh bottle so that they don't contaminate the surface. You keep the area moist for obvious reasons. You shower after the laser treatment in tepid water. Skin should be patted dry, not rubbed. Sunscreens are important. You avoid tweezing, waxing, bleaching or chemical peels during the course of the treatment. And you avoid irritants like tretinoin and benzoyl peroxide. Moving on to injectables, botulinum toxin A, fillers and mesotherapy that I'll be covering here. For botulinum toxin A, what are the post-procedure modalities that you follow? You avoid rubbing and massaging the treated area for 24 hours, because you don't want to make the Botox spread to other intended muscles. You avoid strenuous physical activity. You avoid consuming large amounts of alcohol. Alcohol increases the chances of bruising. So you ask your patients to avoid alcohol for 12 hours at least. They avoid getting facials done, chemical peels, microdermabrasions for 24 hours. In practice, we normally tell them to avoid facials at least for 7 days because we don't want them moving the muscles too much. They avoid blood thinning medications. If there is a bruise, topical vitamin K and arnica can help. I'll go on to arnica in my subsequent slides. Pulse dye or KTP laser treatments make the bruising go away faster, and at times you can use green or yellow concealers to help cover up the bruises. There have been studies on botulinum toxin A, and the post-procedure they found that ecchymosis and edema can be seen up to 25% and 13% of patients respectively, and ecchymosis has been found to be the most frequent treatment-related adverse event. So what do you do if you have a patient with ecchymosis? You actually need to do a lot of modalities I'll discuss probably after the fillers. In fillers, cool compresses are very important because you want to reduce the swelling, you want to cut down the potential for bruising. You have to ask the patients to wear the makeup a day later. As I said, mineral makeup is something that works well. You do not want them to rub or massage the treated areas to avoid excessive mobility of that area. And they avoid strenuous exercise. Acetaminophen is something that is recommended, and that too post 6 hours. If you have to recommend a painkiller to a patient with fillers, you do not recommend it in the first 6 hours, and ibuprofen or aspirin is not to be indicated. It is acetaminophen that you tell your patients. Why should you not prescribe a painkiller for the first 6 hours? Because you want to make sure that you have not done an intravascular injection. And the first sign of intravascular injection is pain. So you have to avoid in the first 6 hours. Again, the avoidance of alcohol to cut down the bruising and swelling, avoid extended UV exposure, and other skin care or laser treatments at least 2 weeks after. There can be a lot of adverse events: bruising, edema, ecchymosis, lumping, reactivation, infectious granuloma, foreign body granuloma, and bruising is something that really bothers us. This is one of my patients that I bruised, and she sent me a lot of those WhatsApp messages that Anuj showed, a lot of choices of abuses. I lost this patient, and I lost my money as well because she never paid up. She walked out of the clinic without paying anything. You can have adverse events like this. You can have edema, ecchymosis. And is there a role for arnica and probelin in prevention of post-procedure ecchymosis or edema? We all prescribe arnica topically, orally, but does it have a role? The objective of this study that Rajat actually forwarded to me, the objective was to review the literature, and they found out there were around 30-odd studies that were done. They covered basically the oral arnica, the topical arnica, and oral bromelain, and they found that most of these studies, they could not find any change after arnica. And so they concluded that there is insufficient data to support use of arnica and probelin post-procedure, and the authors recommend additional research to determine the efficacy. But in whatever studies they reviewed, that is 4 studies out of 13, they did find some improvement after arnica, and the effects of arnica and bromelain were best demonstrated when they were administered pre-op and continued 1 to 4 days post-op. So 4 out of 13 studies did mention that arnica had some positive improvement. We carry on using arnica with the hope. I don't know whether it works or it's just a placebo effect. The pharmacology of arnica, it's basically anti-inflammatory and anti-edematous properties, and it's not been completely elucidated. There are a lot of other mechanisms that have been said, that it inhibits the histamine release from mast cells, it inhibits the secretion of serotonin from human platelets, and thromboxane B2 formation. Then the anti-inflammatory property of oral bromelain. Bromelain is incidentally an extract of the pineapple fruit, and this is available in India in combination with a trypsin. It's a tablet formulation that is available. I used it but did not find any change actually in my patients. The mechanism is probably almost the same. There's a reduction of prostaglandin E2 and thromboxane B2 along with inhibition of interleukin 8. Oral arnica also gives us a lot of stomach irritation, so you have to be careful. These are homeopathic medications, but there can be stomach irritation, dry mouth, headache, drowsiness, sore tongue and lethargy. Topical arnica can be associated with pruritus, petechiae and dry skin, and there are no significant adverse events reported with probelin. This is a patient of lip augmentation before and immediately after. In fillers, we need to cut down the swelling, so it is very important to use some measures to cut down the swelling after the procedures. So you can have ice soaks, you can do head elevation, you can give tablet paracetamol as I discussed. Some people even advise tablet prednisolone to overall improve the appearance of the patient. If you're doing mesopotox, as Dr. Rajat was mentioning, you need to cut down the appearance. The patient has to go back to a social life. So what do you use? Some of these filler companies provide us these kits which can be used post-procedure. This is by a company called Teosial, and it has a combination of 3 things. They have a concealer which is part of the pack. They have a cream which works as a kind of anti-inflammatory cream. And then they have a filler component which you can use to cover up the face after the procedure. Or you can use ice packs after the fillers. You can use this as a marketing gimmick. Some of the companies provide this, so you can actually use them as a marketing gimmick as well. Moving on to the last bit, chemical peels. This is a horror for all of us. If you see such a patient, it drives you nuts. So in chemical peels, what are the recommendations? This I picked up from a paper from Journal Cutaneous Aesthetic Surgery by Anita, wherein she talks about prevention of complications in chemical peeling. They say that immediate post-peel period, mild soap or non-soap cleansers. If there is crusting, topical antibiotics. Sun exposure obviously needs to be avoided. Calamine lotion in a moisturizing base, which we get now in India, can be used for stinging sensation. Peeling agents like glycolic acid and retinoid should be avoided. Patients should be strictly warned against peeling, picking, scratching, rubbing or scrubbing the skin. And they should be clearly be informed to recognize complications like excessive redness, swelling, burning or pain, etc. Moving on to the last slide, surgeries. When we all do small surgeries, so we have to provide analgesia as a post-procedure modality. We have to provide nursing support, which may include timely wound and bandage maintenance. Consider the administration of antibiotics to prevent post-procedure infections. Monitor incisions for swelling, exudate, pain or dehiscence. Monitor catheters and devices if you're using them. And monitor for procedure-related complications. So going back to that poem that I wrote last night, it's very important to think as a patient. When we do a procedure, think as a patient to get the best results. Thank you very much. I invite all of you to SARC AD, which is happening in Dhaka, 28th and 29th of this month. Thank you very much.